Doctors of Reddit. What is the most stupid thing a patient has said trying to correct you? Story 1. I asked a patient complaining of dizziness if she'd ever been diagnosed with vertigo. The daughter chimed in and said, No, she's a Libra. I laughed hysterically at her excellent joke. She was dead serious. Story 2. A patient comes in with abdominal pain. I think it's my gallbladder, they say. Looking over their chart, I see their gallbladder was removed 20 years ago, which is impossible. I mention this, to which they reply, Yeah, but it grew back. Yes, I know there are several other things it could have been. A retained stone crossed my mind, but after 20 plus years, I found this unlikely. They also have the scar to vouch for the surgery. There was a psychosocial element to this case. Story 3. I took a child that got chicken pox. The mother was strongly anti-vax, but yelled at me, How can modern medicine not have a treatment for chicken pox? She couldn't grasp the concept that we do. She just refused it for her child. Story 4. A mother brought her 14-year-old daughter to the ER due to hypergastric pain and spotting. We asked the daughter when was her last period. She said it was 2 months ago. We asked her for her sexual history, thinking this might be an ectopic pregnancy. The mother kept saying that she was still a virgin and had no boyfriend. We left it at that until her mother went to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested pregnancy tests and HCG tests. It looks like ectopic pregnancy. We advised the mother that her daughter needed immediate surgical intervention. She refused to believe us, saying that the lab results were unreliable and untrue. She keeps on saying that her daughter's a virgin. Finally, she stormed out of the ER with her daughter, who looked in pain. Story 5. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was morbidly obese and had open sores and wounds in all her skin folds. Cleaning her when she was first admitted was like some disgusting clown car. We found a floral pillowcase shoved under one fold and what we thought was a smashed bread crust in a fold near her groin. Anyway, because of her weight, she wasn't a candidate for surgery. Therefore, our team could do nothing for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician he didn't know what he was talking about and that she had been this sick before and pulled through. Her pH was so low it read as negative 6.8, and her blood pressure was a solid 60/25 despite every vasopressor under the sun running at 3 times the maximum doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said, Push, I've seen lower. When she finally died, her family was livid that we didn't save her. We coded her for 20 minutes and they told us we should have continued for at least an hour. I felt terrible that her last days were tortured because her family was in such denial about her condition. Story 6. I had a patient with arterial fibrillation that needed to be on anticoagulation. I chose Pradaxa and the patient said no. That one does not have any antidote. It's the only new oral anticoagulant with an approved reversal agent. The patient refused to believe me, like I got some bonus for killing her or something. Story 7. 1-year-old hospitalized with ingestion of the unknown drug. No immediate signs or symptoms. Mother says it is heroin from her brother's stash. The urine comes back positive for meth. Mom gets furious and defensive and tells us it is just heroin and we should stop accusing her of having meth. Why do you think letting your toddler try heroin is so much nobler? Another one I remembered back from my GP days out in the middle of nowhere. Lady comes in with itching on the scalp. I look at her head, and she has matted, greasy, filthy hair that smells. I've seen a lot of dirty people, but it was something else. She wanted medication. I suggested she wash and comb her hair regularly for a few days to see if it would improve. She said, And what if I wash my hair and it doesn't get better? You can accumulate the filth again in 10 years, so it is not a permanent loss. Story 8. My aunt had various medical issues after a long period of alcohol dependency. She had to have a large part of her bowel removed and underwent various surgeries to keep her alive and give her a half-decent quality of life. She went on to marry my now uncle and lived the rest of her life in happiness. One day, she called from the front room in the kitchen and said, Phil, call me an ambulance. Uncle Phil stuck his head around the corner and said, You're an ambulance. He came back in with a cup of tea for my aunt. She asked when the ambulance was going to be there. It turned out she had had a heart attack. She survived it and died like 5 years later. Story 9. I introduced myself to a patient as a doctor, your anesthesiast. The patient said I could not be a doctor as anesthesiasts aren't doctors. Not long after, another patient asked me if I had to go to uni to be an anesthesiast, and another asked me if I had to know as much as a pharmacist. The number of patients I have seen who are acutely unwell because they stopped their medication does my head in. They almost always stop the drug, and the condition they were taking it for disappeared. Story 10. I worked in a pharmacy. The most memorable was when a community psychiatrist nurse brought in a patient with a bag full of medicine to return because he's been doing so much better. The patient had been sectioned twice and was only better because he was on 4 different antipsychotic medications, which had taken 18 months of trial and error to stabilize him on. The pharmacist was spitting feathers. I thought he would punch the CPN. We had to inform the patient's GP. Luckily, the patient was now lucid enough that he knew the CPN was an idiot and had only played along because he wanted a new caseworker and figured people would believe him better if he let the CPN demonstrate his idiocy in person. Story 11. I was passing through immigration in Dallas, and the officer asked me what I did for work. After I told him, he said, "Oh yeah, an anesthesiologist. You're guys who kill patients and bring them back to life." I replied, "Less of the former and more of the latter." Story 12. 25 years ago, I had a hell of a time as a kid because I had myopia at age 7. My family didn't allow me to wear glasses unless I was outside because they believed the eyes would readjust to normal and prejudice would decrease. I ended up perpetually squinting. No, my myopia never went down. I have very high diopter myopia in adulthood now. Story 13. Had a female patient. Her mom asked me to adjust her scrotum. Trying not to laugh, I said, "Your daughter's scrotum?" She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing. And I also wanted her to go around saying it to other people. Story 14. Med student, but a patient told me about how a doctor suggested she may have eye shingles, trying to get me to laugh at the other doctor because shingles of the eye are ridiculous. You can get shingles in your eye, though. Story 15. I had a patient come into the ED for a cold. She kept requesting antibiotics and explaining that they wouldn't help her viral symptoms. But I then sat down and gave her a basic tutorial on the difference between bacteria, viruses, antibiotics, and antivirals. Hopefully it was enough to help her in her medical school finals the next week. Story 16. Over the past 2 years, I cut down on caffeine a hell of a lot. I would drink 8 cups of tea or coffee daily. I would get headaches after an hour or two of not having one. I couldn't sleep and concentrate on anything. Now I'm down to a cup of coffee in the morning, a cup of tea in the evening, and a coffee around lunchtime if I feel like it. I'm like a brand new person. Story 17. A 17-year-old girl who was pregnant came into the emergency department to get checked as she was punched in the stomach. She wanted to go out for a smoke, so I did the whole pregnancy and smoking spiel. She stopped me and told me I knew nothing as the baby would be harmed if she stopped smoking straight away. Story 18. When I was a medical student, this middle-aged male patient from a rural area got it in his head that I knew absolutely nothing, and he was serving me by teaching/talking to me. He was in the cholectoral clinic for something unrelated and started telling me about the gland on his neck that would drain every so often. When he saw that I was unfamiliar with this particular gland, he gave me this unknowing look, laughed, and started instructing me, the dumb little medical student, about this gland. Everybody has this gland for the immune system, but he would drain when he was stressed. No, sir, I was being polite, but you have a nasty effing abscess on the back of your neck. I was hoping that the patient would try to explain this medical wonder to my attending when he came in, but alas, he didn't.